Hello, and thanks for watching my video. I just want to put a short video together if you're dealing with either acute or chronic pain or conditions. And I put the title as "What is your story?" because that's what we want to focus on here. And the goal is to help you identify physical, emotional occurrences in your life which may have caused or may be causing you to develop chronic symptoms. When did those things happen? How have those occurrences impacted your physical and emotional health? And what is happening right now, and how can you minimize the effects? Once identified, what steps can we take to begin the healing process, especially if maybe what is or what was acute has become or could become chronic. I deal with chronic conditions as far as with neuropathy symptoms and chronic pain and things like that. I'm not going to get into all of my story right now, but please be aware that although I don't know exactly what you're going through, I may have a pretty good idea. So people will want to potentially judge you by what they see, but pain and the things that you go through that's invisible make it very difficult for other people to understand, and it makes it difficult for us to deal with and to understand ourselves. But so trying to manage my mood and adjusting everything in my life to function the best that I can. And if you're dealing with a chronic condition, especially if it has affected your mental health, it's so difficult. And again, I do understand that. I've been down that road myself, and I still deal with those type of issues. But I would try to describe to the doctor, to my wife, just kind of use some analogies to help them better understand what I'm going through. And maybe you've done this yourself, but I'll say things like, well, you feel like someone's taken an ice pick to describe the pain or the stabbing sensation, and someone's just poking you with that ice pick or a knife or a hot poker and stabbing you. Or if you have issues, neurological issues that affect or those sensations as far as pain, it could feel like something crawling on your skin, and you're constantly checking to see if something's there and it's not. Or like your muscles feel like they're burning or like they're on fire. Even if it's like in an air conditioning setting, what somebody might feel as a cool air to you or to I will feel like it's burning on our skin. Another thing I'll use as an analogy is like someone who is drowning or just barely being able to stay or above water, just barely being able to keep your head above water to function. Or like you're lost and can't find yourself, like someone is taking a clamp as far as like the physical symptoms around different parts of your body and just squeezing it, and on and on. So we try to describe these things to people, and it's difficult to come up with the correct analogy for somebody to really understand what you're going through. So that's where I'm at today, and deal with a chronic condition on a daily basis. I want to help you in any way I can. I really feel for you, and I want you to know that you're not alone. Sometimes it just helps to know that somebody else is going through something like this. And although nobody can know exactly what you're going through, it helps to know that somebody cares, and you're not just imagining things, and you're not going crazy. So some of the things I put together here is to try to focus on finding anything that helps even a little bit. So don't give up. Sometimes you have to just hang in there and be patient with yourself. It's frustrating, especially when you're once active and you see others around you doing things that you used to be able to do, It also feels frustrating when doctors don't have all the answers. It's frustrating when they say things that don't make any sense. So don't let anyone stop you from seeking out the answers and moving forward to be in the best health that you can possibly be in. Pain is real. Our brains are very delicate, complicated pieces of equipment along with our bodies, and it's all interrelated. So what happens to us physically affects us mentally and emotionally. What happens or has happened to us mentally or emotionally affects us physically. So keep taking steps to move forward, even if they're very few and very small steps. I also understand that sometimes you may not be able to do anything, and I've been to that point. So like I say, if you're dealing with a chronic condition, it may not be something that's going to go away, but any little bit of improvement is good, and that's what you're looking for. So be patient with yourself. Sometimes you just have to wait to have a better day. And when you have a little better day, and then you have a setback, be patient with yourself again. So it's not easy, and it's hard to get other people to understand what you're going through, but be patient with them and patient with yourself as you're going through this, or as we're going through it together. So what's your story? That's what I wanted to ask. Take time to write it down. Think about things that may have happened in your past that could have affected your health in a negative way. Also think about the times in your life that brought happiness and contentment. Are there some things that you can do again that you used to enjoy doing? I know, how can you focus on the positive? What new hobby or interest can you get into? How can you have fun again? Think of dealing with a chronic condition as beginning as a child. I had a doctor tell me that, and it really hit home, because you kind of have to learn things from the beginning all over again because of where you're at with your health. So it's good to think of it that way and to keep growing and learning how to manage your symptoms, to find things that will help while kind of discarding those things that are not helping so much. We don't know what each day will bring, but we can care about each other and encourage each other and do the best that we can do each day. I put a couple videos together. One was tackling worry and anxiety, and there's two parts to it. If you get a chance, please watch those. I think there's some good information in there, and it kind of gives you some ideas of some things that I do that are some practical ways to help, especially with the mental health aspect as far as worry and anxiety. I want to get into a few more things in another lesson that talk about some things that's been beneficial for me as far as some physical therapy things that I do, and maybe even some medicine management. So please take care. I want to try to keep this short, but please understand that you're not alone, and there are people out there who care and want you to take care of yourself.